Good morning, everybody. Thank you for that wonderful introduction to the meeting, Roberta. I'm very honored to be part of this meeting and to be part of the community and privileged to serve the families and the individuals affected by Alagille. Today, I'm going to share my, see if I can get this slide deck up here. Okay. Are you seeing what you should be seeing? Yes? Okay, good.
Yeah.
Good. So um, today I'm going to speak about my experience. I think it's actually 3 years, Roberta. Time flies when we're having fun here at the Alagille Syndrome Alliance, supporting the emotional health of community members affected by Alagille. There are a number of lessons I've learned from the work with all of you in this community, as well as lessons I've learned from other communities and my own personal experience with rare disease. So I'm going to share some of that over the next 40 minutes or so, and I hope this is helpful. I see many familiar names here or attending the meeting, and some of you who may not know me. I want you to know just a little bit about me and how it is that I landed here with all of you. 30 years ago, 31 years ago, my son on the left, named Jack, was born in Madison, Wisconsin, 1995, a healthy 8.5 pound baby. But at his 6 month check-in, pediatrician check-in, we learned that baby Jack was not developing normally from the pediatrician. And 4 days later, baby Jack was diagnosed with a muscle disease called spinal muscular atrophy and given 1 year to live. Thankfully, my boy didn't fully cooperate with his prognosis. Baby Jack lived to the age of 26. He passed about 5 years ago, and I'm very, very lucky. I was very, very lucky to be his dad, to have him here with us for so long. He taught me a lot of very important lessons. And he's really the reason that I feel credible serving the Alagille community and other communities. On the right, professionally, parallel to raising Jack, I am a practicing psychologist. And Jack was born just when I was finishing school. Because of the experience of caring for my son, I began over the years to focus my attention on other families who were challenged by rare disease. And on the right-hand side, as a symbol of that work, for about 25 years, I've been facilitating support groups, both in person and online, at my own extended family. That's what I call all of this extended family. I'm a visitor in your extended family today, and I'm grateful for that. Cure SMA is my extended family, and for 25 years, I've had the privilege of facilitating support groups for community members in my own community. And from this work, I began to serve other communities by providing counseling, facilitation for support groups. And I now also do consulting for pharmaceutical companies who are treating rare diseases and supporting leaders like Roberta around the country and around the world who have the courage and the strength to take on the responsibility of supporting families affected by rare disease. So I feel very privileged to do this work. By the way, I have a daughter also in that photograph on the right. My daughter, Kara, is standing next to me. Kara was adopted from Korea when Jack was 5. She's now 26. She's going to be married in the fall, and she works full time at the National Organization of Rare Disorders, NORD, in the membership department. I'm very, very proud of my daughter. And on the left in the orange shirt is my wife, Patty, who's down the hall where I am right now and who I met at that conference 8 years ago, and her daughter, Georgia, who all volunteer with our families. So for many, many years, I've been involved in rare disease, and for 3 years involved with your community, and I feel very grateful to be here and to share what I've learned, both from my son, from other communities, and now 3 years with your community. Today, I'm going to talk about the common emotional challenges and mental health challenges that we observe in Alagille families, individuals, and caregivers. Second, as Roberta said, your community has launched the Essential Mental Health Program fairly recently, and I feel very fortunate and honored to be helping to provide support through the Essential Mental Health Program. And third, I want to emphasize today the power of peer support in building resilience. So much of what happens in the Essential Mental Health Program with the Alagille Foundation is peer support. There's nothing more valuable. There was nothing more valuable to me as a scared young dad with a baby with a incurable disease at the time, to have the support of others. And I find over and over again that peer support builds resilience, and I'm seeing that over and over again amongst the community. Those are the three overview items I'm going to speak about today. We know, dealing with Alagille syndrome and other rare diseases, that we all have to focus on the medical and physical day-to-day practical realities of the intrusion of a rare disease. It stands to reason that the attention to mental and emotional health lags behind and has lagged behind in rare disease, the attention to physical health. I will tell you that for 26 years taking care of my son, I didn't have time to talk about how I felt about my experience. I was busy keeping him alive, literally. And I'm a psychologist. And so it is my experience that the attention to mental health lags behind the attention to medical needs and physical needs for obvious reasons. The pandemic seemed to shine a spotlight on mental health. The rest of the world, uh, outside of people with rare disease, found found themselves struggling and scared about the uncertainty that came with the pandemic, the fear of catching an illness that could be life-threatening. Everybody's worlds kind of turned upside down, and everybody in the world focused on mental health for that period of time. And because of that, a spotlight shined on mental health as an important area of focus, that we shall take care of ourselves. And that focus on mental health that came during the pandemic has come into the world of rare disease. And I'm a very busy guy because of it. Many rare disease communities are focusing more attention on the mental health aspects of the condition. You don't need to have a PhD in psychology to figure out why being affected by a life-threatening condition is stressful. It's obviously stressful. So mental health is important too. There are many studies that show across rare disease that the prevalence of anxiety and depression is higher amongst people affected by rare disease and caregivers of people affected by rare disease. Again, you don't need a PhD to figure out why that is. It's an extraordinarily stressful experience. Mental health is important too. And Alagille has a great amount of emotional weight, along with the intrusion of the symptoms of the condition itself. I've gotten to know so many of you and your families through my work with Roberta and Cher in the foundation, through the support group facilitation. I didn't realize, Roberta, that 90 groups at this point already, if I'm not surprised. Um, a lot of people have taught me a lot about the emotional weight and the weight of what individuals and families carry when it comes to Alagille. And many of the things that I've observed overlap can overlap a great deal with the emotional weight of other rare conditions. Some are unique to Alagille, including what Roberta just mentioned about invisibility. But we all carry a great deal of weight when it comes to rare disease. And among the lessons I've learned from all of you and so many other rare disease affected patients and families is that the diagnosis of Alagille is life-changing. There's the life you have before Alagille arrives and intrudes into one's life, and there's a life we have after it. And for me, with personally, it was two different lives. The life before my son was diagnosed, the life that came after. We're two different lives because at the moment Alagille comes into your lives, your world changes. The things you have to think about change. You can't do things the same way everybody else does. You can't do things the same way you used to do them. And you're living with a great deal of concern and fear and uncertainty at different points in your lives as things evolve and things change and symptoms intrude. The diagnosis is the starting point, and I find that uh, families with a new diagnosis have very unique needs, often experience symptoms of trauma. I certainly did, and most families affected by life-altering rare diseases experience trauma when receiving a diagnosis, the journey towards diagnosis, because it's so scary, disorienting, and overwhelming. When we have a rare disease intrude into our lives, it's like being launched into the twilight zone where we're all by ourselves, floating around in the twilight zone, feeling like nobody could possibly understand what we're experiencing. And it's not until we connect with others who also have been launched into the rare disease twilight zone that we can get our feet under us and try to figure out how to put one foot in front of the other and move forward with our lives. So the first lesson I've learned is that a diagnosis of Alagille, the intrusion of this condition, is life-changing, scary, and can be very overwhelming. Another lesson that I've learned as a psychologist specializing in rare disease, and this cuts across every rare disease, every community I serve, no matter the country, the culture, the condition, the symptoms, anyone affected by rare disease is living with a great deal of uncertainty. And the Alagille community is no different. So much uncertainty when we cannot know what the future will hold. Uncertainty has manifests in different ways. There's sort of two buckets of types of uncertainty that I see in the Alagille community. One is the existential level of uncertainty, the big picture. Why is this happening to me and my family? Is there a place in the world for me and my family? What will become of us? What is the purpose of all this? People struggle to make sense of why rare disease, why Alagille intrudes into one's life. That type of existential uncertainty is very common at the beginning of a rare disease journey, and it's also very common at different points of transition within the Alagille journey. So many individuals and families are needing to worry about, anticipate, undergo transplants. Organ transplant is a huge, huge life changing event. And the uncertainty that comes with transplant, organ transplant, in the case of Alagille, is one of many examples of the reasons that uncertainty is a very hard way to live. That existential level, what's the meaning of this? Where do I fit into the world? And then there's the day-to-day uncertainty. That's the second bucket of uncertainty. The second bucket of uncertainty is, are the symptoms that I'm experiencing going to become more serious than, or are they going to be nothing? Will I need to have a transplant? And is that what this symptom means? How do I do my job? And will my employer understand tomorrow why I can't work the same way tomorrow as I did yesterday? There's the day-to-day challenges that come with rare disease. For me and my son, it was, will his symptoms mean that we end up in the hospital tomorrow, or will they turn out to be nothing? That day-to-day uncertainty led me to drive around with a suitcase of clothes and a toothbrush in the back of my car for 20 years because we never knew day to day when Jack would get sick and we'd need to go to the hospital. It's very hard to live with uncertainty for members of the Alagille community for a great deal of reasons. Common emotional challenges specific to Alagille are listed here. Again, I mentioned the trauma of a diagnosis, the loss of the life we had and the dreams we have for our life, and we need to then replace that set of dreams with a different set of dreams. And it's a very disorienting experience at diagnosis to try to make sense of our experience of our life and how we can adapt and move forward with our life at the time of diagnosis. It's very hard to do. And in every new medical milestone, there can be grief, there can be trauma uh, because of the unknown, because of the medical risks, and because of the changes that need to be made day to day in lifestyle. Second, again, chronic uncertainty. When we cannot know what the future will hold, it's a very hard way to live. And everyone with Alagille needs to tolerate the certain amount of ambiguity and uncertainty because we cannot know what the future will hold. Nobody can know what the future will hold, but when we have Alagille syndrome or Alagille syndrome in our family, there's an additional complicated layer of uncertainty that's very hard when we don't know what our prognosis may be and we don't know what the future will hold. It's a hard way to live. For all those 26 years, I could never forget being told that our baby would live for 1 year. And when he lived to 2 and 3 and 4 and then kept on living, we celebrated every birthday and we celebrated every day and appreciated every day. But that cloud of uncertainty followed us wherever our boy went because of the unknowns that came with his rare disease. Uh, Third challenge in Alagille is isolation. Very few people understand what it's like to have Alagille syndrome. Most people have never heard of Alagille syndrome. I hadn't heard of my son's condition until he was diagnosed. I hadn't heard of Alagille syndrome until Roberta tracked me down and asked me to help your community. And so it's understandable that those in the Alagille community, those of you in the community, would feel isolated, especially before connecting with members of the community, because so few people understand what this is about. Few people know about it. Few people can relate to it. And it's hard for other people to get it. Which leads to the fourth point, which Roberta again mentioned, the invisibility of the condition to other people. In my work as a psychologist, I see many community members in other communities who have very visible conditions. My son had a wheelchair and a feeding tube and lots of medical equipment hanging on the back of his wheelchair. So his disability and his rare disease was very visible to other people. And in communities with visible conditions, nobody questions that there's a problem. Nobody has any doubt that there's a problem. But in communities like yours, the first time I walked into a room full of people with Alagille at the retreat in Detroit last year, 2 years ago, I may not have known at first glance that there was anybody with the rare disease in the room. And that's both a gift and it can be a burden because when your condition is invisible, then people don't know and understand why you need to do things differently, why you have to worry about things they don't have to worry about. And then people are faced with having to explain themselves over and over again to help people understand, which is another burden. It's very isolating to live that way when your body isn't functioning the way it's supposed to and the way everybody else's does, but others can't see that. And finally, this should come as no surprise. The healthcare system in the United States, anyway, and I hear it from people around the world for other reasons, different reasons, is very complicated. So, in addition to managing the symptoms of Alagille, navigating the healthcare system, finding specialists who understand Alagille, dealing with the appointments, the insurance system, the Medicaid system, the insurance system, the state level systems is very complicated, very frustrating, and another obstacle. There are a couple of other communities that actually have me teaching workshops to families on how to deal with the healthcare system because it's a whole separate set of challenges that become very exhausting, emotionally exhausting for patients and families, certainly were for me as a dad for those 26 years. So these, in one slide, capture the common emotional challenges that are experienced by individuals and families affected by Alagille syndrome. They should come as no surprise to us. Um, they're fairly self-explanatory because when you have a condition that is so complicated, emotional challenges will come along with the physical challenges. Now, what do we do when we find ourselves in this very complicated and sometimes it feels near impossible situation of having a life-threatening or life-altering rare disease? And what do we do when we don't feel very hopeful based on diagnosis, based on prognosis, and based on the fragility of our bodies when we have a rare disease? When my son was diagnosed, we had 2 weeks of medical appointments and we were introduced to all kinds of medical equipment and procedures and things that parents shouldn't have to learn. The doctors left us with a lot of information, and in rare disease, we're given a lot of information, but often not too much hope. Um, and I found over the years, personally and professionally, that hope comes when we spend time with other people who are hopeful. And in rare disease, it carries a lot of weight to find our way to other people who have been in the journey that we are embarking on, people who are ahead of us on the journey, who live their lives with grace and dignity and face the adversity of rare disease with a positive attitude and find their way from that place of fear to a place of hope, managing to um, deal with the real challenges of the rare disease, but doing it in a way that is more hopeful and positive and solving the problems, finding their doctors, being able to work, have relationships, and to continue on with their lives. When we, as patients and families affected by rare disease, spend time with other people who are hopeful, we feel more hopeful. We lift each other up. And this concept is very important to me to share with you. Hope breeds hope. When we spend time, it's obvious again, when we spend time with people who are hopeful, we're going to feel more hopeful. When we spend time with people who are without hope, it's not going to help us, it's going to bring us down. So we need to find our way when, especially at the beginning of a journey or when we're at a transition point with something significantly risky or stressful or intrusive medically, it's really important for us to find people who can offer us a positive approach to dealing with it and examples, role models of people in our communities who have managed to meet these challenges again with such grace and dignity, which I see in your community over and over again. This leads to my other broad and most important point is that the community strengthens and supports each other. That photograph you saw of the children from my SMA community is a symbol of the children at their conference strengthening and supporting each other. And when we're a member of a community, a rare disease community in this case, it only helps us. There are other types of communities we're a part of. We're part of our neighborhood communities locally, our school communities, our faith communities, our work communities, and all have the potential to be helpful and all have the potential to strengthen us and support us. People do want to help. And if we show others and teach others, explain to others what they can do to help, people do step up when they know how to help us. That's what community is about. A rare disease community, this community that I'm here with today, all of you, is a very special community that strengthen each other and support each other. I have seen that in person at two adult retreats now, and another caregivers retreat is coming in October, as Roberta said. And I've seen this 90 times in support groups with caregivers and adults, community members stepping up to strengthen each other and support each other. Being being here today is being part of a community and hopefully participating in this event these 2 days will strengthen and support you. We can't do this alone. It's too much for any one of us, and it's too much for any one of our families to do alone. And the unique nature of rare disease communities I've seen across the country and around the world is that people in rare disease communities not only strengthen and support each other, but lift each other up. People in rare disease communities are all kind. I never meet anybody who's not nice when I travel the country. I'll be on a plane today to see another rare disease community in Arizona. I'll be talking with you tomorrow with the panels from Arizona, and I guarantee that the group of patients with a different condition are all going to be nice people who are respectful to each other, who are kind to each other, who lift each other up, and who bring out the best in each other. That's what you do in this community, and that's what I see in rare disease communities, because that we all understand the difference between what's a big deal and what's a small deal. We all have perspective on what's important in life. Rare disease communities strengthen and support in very special ways. Now, the Essential Mental Health Program, I love the title, and I credit Roberta for introducing this title first to me when she tracked me down and I had my first meeting with her. She said, I want to have an essential mental health program. And I appreciate this community and specifically Roberta's emphasis on mental health being attention to mental health being essential, not an extra, not an add-on, but an essential and central part of the experience of being part of the Alagille community. Essential is an unusual word in my experience. Interacting with many rare disease communities is the only community that I've seen this word used in this way. And I appreciate your community's prioritizing emotional health and mental health as part of the support that you offer to each other through the foundation. As I mentioned before, as a psychologist, the most common burden, the most common problem, the most common experience that leads to symptoms, mental health symptoms, especially depression and anxiety, is isolation. Isolation doesn't help us. Isolation weakens us. Isolation makes us sad. Isolation makes us feel alone. And in some cases, isolation leads to clinical depression. It's one of the heaviest burdens in Alagille. It's one of the heaviest burdens across all rare diseases that I work with. The antidote is connection. The opposite of isolation, being alone, is being connected to other people. That's why being part of a community is so important. And the way in which that connection occurs through our essential mental health program at Alagille Foundation Alliance is peer support. I am, as I mentioned, a psychologist by training. And for 20 years, I had a practice in Philadelphia where I'm from. I had 2 offices there, and I saw local families, and I saw them one at a time. And I consider myself a good psychologist. I've done really good work as a psychologist, providing individual counseling and therapy services to families, both locally and now nationally, within the context of rare disease. But in serving one family at a time or one individual at a time, the traditional counseling model, I'm only able to help one person at a time. And the people who have a shared experience are not available to help each other. Now, in my work, through this program and many other rare disease communities, I'm seeing the power of peer support. When peers who share a common, and in this case, rare experience of Alagille, have time with each other, the power of peer support, in my estimation, often is more valuable, at least as valuable, if not more valuable, than the support of a professional trained psychologist like me. Um, I don't I don't intend to put myself out of business by pushing this line too strongly. I still do individual counseling and have a private practice. But my point here is to impress upon all of you the power of being together in a community and the power of being together in programs where you can have the opportunity to be supported by peers who share the rare experience of Alagille. And that's uh, the central tenet of the Essential Mental Health Program, the power of peer support. The two primary uh, pillars of support, the ways in which that this support has been provided, have been through support groups and retreats. There are other programs like this presentation and other there are educational programs. There's information on the website about emotional support. There are other types of support provided through this program, but the two primary that I'm involved with and that I think are most powerful are interactive. With our support groups, we meet twice a month, excuse me. Alagille affected adults have a group that meets twice a month, and caregivers of Alagille individuals meet twice a month. These groups happen on Zoom. The support groups are an hour in length, and I am the honored facilitator. As a facilitator, I'm very intentional about not coming with an agenda. It's not a presentation like I'm doing right now. It's an open time for members of the community to be together on Zoom and to share with each other their questions, their concerns, and their resources without any set agenda. The agenda is set by the people in the group, and it changes from group to group and from hour to hour and sometimes minute to minute. Um, People are welcome to come and go as they can and as they please. People in the community are welcome to listen and not speak. People in the community are welcome to have their cameras on or off. Um, and these groups become small families, and everybody comes back. There were a bunch of regulars who come back, many, if not all, of each meeting of the group to check up on each other, to provide support to each other, and to share experiences. It's a very powerful opportunity for members of the community to be together. Retreats. We've had two in-person adult retreats, one in Detroit and one in Florida, Orlando, last January, and a caregiver retreat is coming in October. I'll share with you that this most recent retreat in Orlando, about 28 adults, a physician colleague, and Roberta and Stephanie, members of the staff, together in Orlando for 2.5 days. 2.5 days, not of lectures, not of sitting passively listening to professionals talk at the adults with Alagille, but these are 2.5 days of connection, workshops and discussions and support groups and some information sharing, yes, but it was very much the retreat, people talking with each other, both as part of the formal program and the schedule that Roberta developed, and lots of social interaction over meals and in the evening, where everybody got very strongly connected with each other. And many in the group had never met somebody else with Alagille syndrome before. I can tell you that I travel the country and the world doing this kind of work and giving talks and meeting with patient groups as I will be in Arizona tomorrow. And of all of the events I've been involved with over the years, supporting families and communities with rare disease, the adult retreat that we had in Orlando with your community, to me, was the most impactful that I've ever been a part of. And I felt so privileged to be witness to these conversations and to help lead some of those conversations and facilitate the workshops. An extraordinary group of adults with extraordinary motivation, extraordinary gifts, extraordinary kindness, and extraordinary courage, all together sharing the unique experience of having Alagille. So the retreats in person are a beautiful thing. They can't happen as often for obvious reasons of logistics and resources. Support groups happen much more frequently on a regular basis. No travel is needed. You can be anywhere, and as long as you have a device that can connect to Zoom, you're in the support group. And we've had people attend support groups from many different places, on vacation, in the hospital, at home, on in their cars. Doesn't matter where people are, they're always welcome in our support groups. And it's a beautiful thing to not need to travel in order to connect. Well, one last comment about that, and in this particular session as an example, Zoom has brought people together again since the pandemic. Things have changed greatly. If you had told me 10 years ago, even uh, 10, 15 years ago, if you had told me, Dr. Al, that I would be working from home and doing so much of my work online to do counseling work and to facilitate support groups, I would have said 10, 15 years ago, I don't think that's going to work very well because I'm an old school practitioner who believes in person. But I can tell you, these Zoom support groups for your community and other communities are so powerful and such a convenient way for people with Alagille to come together and to be part of a group and to feel as though you're part of a family. These are the two primary pillars of support in our essential mental health program, and what a powerful experience for everybody who's involved. Oh, here's a photograph. I was able to get a couple of photographs. Thank you, Roberta. This is a photograph from our adult retreat. This is a photograph of, I believe, yes, our adult panel. So we had 28 adults at the retreat. And during this session, 4 of the adults who were attendees of the retreat were panelists. And again, I had the privilege of moderating this panel. And the 4 adults in the community who shared their experiences shared openly and honestly about not only their medical experiences, but their emotional and mental health experiences, which helped the others at the retreat to understand that these experiences are common. The people who were up front as panelists had the courage to share their personal stories. They chose to do that. Everybody has a personal story, but not everyone feels comfortable sharing it in public and shouldn't be expected to. In this case, the other 20 some adults had the opportunity to hear these personal stories and learned a great deal from them. As Roberta mentioned, tomorrow, an adult panel with some of the same adults, a couple of the same adults, will be part of the program. I'll be facilitating a similar adult panel on emotional health tomorrow. I'm sitting in Chicago now. I'll be in Arizona tomorrow, but I will be with this laptop in a different location to facilitate that panel, and I greatly look forward to it. This occurred at our adult retreat in Orlando in January. Here's a group photograph, a symbol of the positive spirit that you can just feel it coming through that picture. I feel it right now coming through my computer screen. This is the entire group that participated in the adult retreat. The majority, I think 28 adults and a few staff members. I'm sitting in the back there, just so honored. Everybody felt so honored to be together for those 2.5 days and learn so much from each other. And it was especially poignant for those who had never had the opportunity before to meet another person with Alagille. And we had a special guest. Stephanie's little baby was the star of the show and helped us all have a different sort of perspective as we made our way through the weekend together. What a beautiful experience. And I hope those of you who are caregivers of Alagille individuals will have the opportunity to join us in Kansas City in October. Roberta will be sending information about that soon if she hasn't already. This captures the spirit of the Essential Mental Health Program, the spirit of the retreats. And again, I'm not exaggerating when I tell you that I do so much work in rare disease and in other communities. And if anyone asks me what was the most impactful experience I've observed and been a part of, this was it right here. Thank you all for including me. Just a little bit more about the value of support groups. Back to support groups. First, it's a safe space when people zoom in, especially for the first time, most people don't know what to expect when they come to a rare disease support group. And what people find most 99.9% of the time is people feel safe, they feel understood when they come into an Alagille support group. What happens, as I mentioned, is not an agenda. People talk with, I don't talk at, people talk with, and I'm in a bit in the background, talking about. So many of you have so much knowledge and share that knowledge, know so many resources, professionals and resources that are helpful. People ask questions, people share concerns, people share stories about their lives, people support each other as you all go through the challenges of rare disease and Alagille while also living your lives and working and having families and relationships and being parents. So all of this is fair game during the support group. A unique experience in support groups are when new members enter the community. It's a bit of a welcoming process when somebody new comes into the group. They're welcomed with open arms, usually tentative, usually not sure what to expect, and everybody in the sessions openly welcomes and supports new members of the community as they come in. And such a high value of connection. Reducing isolation increases connection. I'll keep repeating that because it's the core of all of this work. People feel together, people feel understood, people feel connected rather than isolated when they join the groups. Finally, you're not alone. Um, Peer support, as I'm saying over and over, turns isolation into connection. Connection with others leads to the community, and being part of the community builds resilience. I've seen this over and over amongst your community. I've seen this over and over in other communities. And this is exactly, you all call me Dr. Al now, and people come to me for help. But 30 years ago, I was a scared dad who felt very much alone. And it was talking to other people in my community that helped me feel less isolated, that helped me feel connected and less scared, and led me to my community. And that community is what I consider my extended family. This community, Alagille, is your extended family. And again, I feel very privileged to be part of your extended family. And um, one last comment before I finish. It took me about 20 years to experience this and to be able to articulate it. But along with Alagille, and along with other rare diseases that I support, along with rare disease comes some rare gifts. And within the Alagille community, I see so many of those gifts among you over and over again, person after person I meet. Rare disease offers us the gift of perspective. Everyone else's big problems are our small problems. This is true with your community, with everybody here. We have the gift of perspective. We have the gift of creativity. Um, you can't do things the way everybody else does. You have to think out of the box. You have to do things differently. It forces you, it forces us in rare disease to be creative, and we attract people who are creative into our lives. Um, Alagille offers a gift of compassion. We are kind to each other, we're kind to other people, and people with Alagille, especially the children, are magnets for open hearted, compassionate people. Alagille and rare disease often offers us the gift of compassion. Um, Perspective, compassion, um, connectedness. Rare disease, as I've mentioned, offers us the gift of connectedness. I haven't seen connected as strongly as I've seen it in your Alagille retreat. Um, because of time, I'm going to wrap up now. I could go on and on with 25 more rare gifts that I see in the Alagille community of strength, of commitment, of courage, um, of so many different things that are special and unique to this community. And I feel very privileged to be here as part of this presentation and this conference today, and honored to have helped to lead it off. I hope it's been helpful. Roberta, thank you for the honor of being part of this today, and I look forward to the panels tomorrow. and I hopefully land safely in another state. Thanks for having me. And I hope you all have a wonderful rest of your day.
Well, thank you so much, Dr.